For Rebel News here in Berlin, Germany, I'm Tamara Ugolini, again at the World Health Summit 2022 in front of the Hotel Berlin in Central District for the final day of the 3-day conference. We're going to see if we can catch some of the attendees on their way out here this afternoon to see how the conference went and maybe push back on some of their policies and ways of thinking. Check it out. How was the conference?
It was very good, informative, and it was inclusive from a variety of different disciplines, from politicians, policymakers, scientists, health workers, government. So basically, I would say it impacted very well, and it was representative of almost all of the globe, developing, high-income and middle-income, low-income countries. There were specific sessions that I believe has made a major impact and probably will be useful for the policymakers to develop the future strategies.
What would some of those future strategies look like if we could, look at what maybe went wrong, the harms of lockdowns and some of the things that weren't handled as well as maybe they could have been or should have been? What would the future look like then?
It would be probably the message that went through this epidemic for the future pandemics, potential pandemics, lessons learned, and being better prepared, better communicate with others, to approach it internationally, because there were discussions that while people receiving boosters in some part of the world, they didn't have even the vaccine for the first shot. So these type of things, inequalities that exist, they should be tackled with in future in a way that could help everyone, because the disease coming back to us if we cannot. So we are on one boat. So it's not just only an ethical issue, it's also a beneficial issue for everyone. So the discussions went very, very well on regard to the approach that could be taken for the future pandemics, I would say.
What does that approach look like?
Promising, I would say. Yeah.
If lockdowns were included again, would you support them?
I mean, it depends. There are circumstances that lockdowns should be implemented. When the risk of infection is very high and the burden on the health systems is very high, and there is a possibility that the system could be collapsing under the pressure of very many new cases. That's the hard decision that we have to make. Lockdown is not eradicating the disease. It's just postponing or controlling, to give time to the health system to cope itself with a way to be able to to accept more patients, because if the ICUs are overloaded, so people will die not only because of the disease, because of the lack of the ICU.
Right, yeah. I see that you are representing Vancouver, Canada. We're from Canada as well. And in Vancouver, many healthcare workers are still unable to return to work because of their personal decision to not get vaccinated. Do you think that people who choose not to get vaccinated should lose their jobs?
It's a very difficult question, and I'm not an expert to answer that. But what it comes to my mind is that there are personal space that people have, there are rights that people have, but the society has also the right. And so I'm not a manager to make those type of decisions, but I understand that while both sides are rightful, finding a balance between that would be good. I'm a supporter of vaccination. I believe vaccination saved life in biblical scale. Otherwise, if it wasn't the case. So personally, I'm in favor of serving the rights of everyone, as long as it doesn't interact with the health of the whole population.
Regarding the question around, did we know about stopping immunisation before it's entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market.
And knowing now that the Pfizer has admitted that it was never intended to stop transmission, then would the case for vaccine mandates be based on the fact that it was supposed to stop transmission? And would that change your opinion?
again, I'm not an expert in this, but what comes to my mind, it's when you vaccinate people, it's not just stopping something, it's decreasing the rate of expansion of the disease. It is decreasing the severity of the disease. So basically, in these two era, vaccine was effective. It is not perfect. It's not going to solve anything, but it's the only preventive measure that we have that we can decrease the severity and decrease the number of cases to help the health system to be able to, cope with the stress.
As long as the health system is staffed. And right now they are not. Many want to work, but they cannot because they're not vaccinated. The 2-week lockdown, really harsh lockdown. I thought, okay, you know what? I'll give it 2 weeks because it makes sense. You get ready in your hospital, you build capacity, you get your PPE, you get your healthcare workers ready to go. But this 2 years, people lost their businesses.
Seriously disagree
With
with your point that you say that 2 weeks was enough. It wasn't.
I don't think it was enough because they didn't utilize the 2 weeks.
No, it's not. It should have been done. It must have been done, and it must have been done for a long time. That's. I'm not representing anyone. I'm just saying from a scientific point of view. If we don't do that, it would be, disastrous. It could be exploded.
But what about now? It's still disastrous.
It's the way of disasters. We weigh this and we weigh that. And if one of them is heavier, which in my view it is still in some places it is, then I would agree with that. I'm not a policymaker or someone.
That's the thing. Yeah, we have to have that balance with the policymakers and the scientists and the health and the...
my
because
point
they
was,
can think about, look at the children. My goodness. Have you thought about the pandemic facing the children with their development and their psychology? It's been terrible. Thank you, though, for your time. Hello, how did the conference go the last 3 days?
Very well, thank you.
Good.
Yeah.
What was the kind of main topic that you thought would be helpful moving forward for future response?
I think the focus was getting action and stop just talking about things.
Yeah.
And I think it's resonating with people, but we'll see how. Yeah.
Was there any discussion sort of centered around what went wrong and how to better prepare for the next time, with the action, but what kind of action?
I don't want to comment on, I think it's, they're pushing to do things on the grassroots level and also bring in more private sector, right? Because I think the discussions around multilaterals and governments were, setting the policy is great, but it's not really translating as fast as people want it to be at the bottom of the pyramid.
One thing that I didn't sort of see, and of course it's
Sorry,
impossible to meet every
Get
conference.
a taxi ride.
Sure.
Yeah.
Just one last thing. If there was ever sort of this indiscriminate lockdown imposed again, would you support it?
I'm sorry.
Thank you for your time. Best of luck.
Außerhalb des Geländes des Hotels?
Sorry, English?
Ja, sure. Könnt ihr eure Filmsachen außerhalb von dem Gelände machen?
English?
Yes, I know what you mean, but I talk it in German, because we are in Germany.
Okay.
Ich möchte gerne, dass ihr eure Filmaufnahmen da draußen macht.
I don't understand.
Pardon?
It's a walls to live.
No, I don't understand though what you're saying.
Okay, then I do it in English. Please do it by the line out of the hotel.
Oh, okay. Thank
On the
you.
streets, thank
yes,
you.
of course.
Curious how the financiation of this all happens. Yeah,
Yes.
the charity is not independent. The charity wants to rule the world with global health. Yeah, and I do not agree because still we have a vaccination mandate in hospitals here in Germany till 31 of December. And we have to talk about this. My main place is the collateral damage.
Yes.
For the vaccinated. Yes.
All right. So we have officially been kicked off of the property and banished to the sidewalk. The police are watching us. and the attendees are quite hesitant to speak to any media that may be unfriendly or skeptical of what they have to say. With Germany's two-party consent laws, we will tread lightly, and with the rain, unfortunately, we will have to wrap up here today. It looks like the conference itself is wrapping up anyway. So if you want to check out all of our reports as we continue to release them once we get back into Canada, you can do that at rebelwho.com. Here in Berlin, I'm Tamara Ugolini for Rebel News. This trip to Berlin came with some great expense, and if you would like to support our efforts to bring you the otherwise unreported side of what was happening here at the conference, then you can do so at rebelwho.com. We thank you for your support and your generosity as we follow the facts wherever they may lead and are skeptics to the status quo.